This is our last global meeting before our 4-week summer break, and thank you all for joining. I know we had a few people already on holiday, but we really appreciate this because a lot to get through, as we have always said. So this probably marks the end of our sort of response to the emergency COVID situation now, and I think now we're into the stage of thinking about the recovery phase and how radiotherapy should look like, and as we talked last week about how as a group we should be interacting with the other global groups to have that impact and oversight that would be assist the community elsewhere. So certainly the next steps is to we'll be working on a strategic document as to where we go next and how we achieve that, and Birgit's going to give us 5 minutes at the end on that as well, so your thoughts. So today we've got our two main speakers, which is lovely, and as usual please do use the chat function and see how we can get through this. So Shandy, shall I leave it to you to kindly introduce our two lovely speakers today?
Sure. Our first speaker is going to be Colony Brown. She is the Senior Vice President of Marketing and Communications at the Xero Prostate Cancer Charity based here in the U.S. So many thanks for her to the very early wake-up call. But we're really pleased to have her today. She has Xero is well known throughout the industry, and I know many of you on the phone have relationships with Xero, so we're pleased that they were willing to chat with us, that Colony was able to join to share with us their experience and what they're working on, particularly through the COVID lens, and how trying to maintain care for patients throughout this. I know they've been working really hard to be a support there for prostate cancer patients. So so many thanks to Colony, and I'll won't take any more of your time because she has a lot more interesting things to say than I do this morning. So thank you, Colony. And Sam, you've got the slides? Okay, I see you're not nodding. So
I realized I'm on mute. Yeah.
I'll let time over to you, Colony.
Thank you so much, Shandy. I'm glad I left the technology to all of you. Hello, and thank you to everyone who's on the phone. Thank you for all you do to help prostate cancer patients globally. It's an honor to be here. I'm so pleased to share with you hopefully some insights that you maybe haven't heard before on how prostate cancer patients are faring during this COVID-19 pandemic here in the United States. It has certainly been our major focus since everything started in the spring. So let's go to the next slide. I can just give you a little brief overview. I do think some of you are familiar with Xero, so that's wonderful. Our name has our mission right there in it. It's we obviously want to zero out prostate cancer. We're the leading national nonprofit that advances research, encourages action, and really makes sure that patients and families have the support they need. One thing that we're very proud of at Xero, we're very laser focused on impact, and you'll see that 86 cents there on the right-hand side. For every dollar that comes in, 86 cents goes directly to programs and activities to help patients. So very much have been focused on the COVID lens. And I can kind of walk you through some of that in the next few slides. But first, I just want to tell you a little bit about me. I am talking to you about 8 miles from the U.S. Capitol, outside of Washington, D.C., in Alexandria, Virginia. I started Xero 7 years ago, which sort of coincided when Xero was starting to focus on building its patient support portfolio. So it's really been an honor to see us get to where we are right now, 7 years later, in being uniquely suited to support patients through this pandemic. We of course, obviously had no idea that this was coming, but it really has, all of our programs have lent itself to this moment. So Feel grateful for that. As a reminder, I'm not a medical professional, but a marketer by trade. But in my position, I have oversee all of our patient programs, including a case management program, which I'll tell you a little bit about later, as well as our peer-to-peer programs, our education suite, and then all of the communications and marketing for the organizations for Xero. So let's just dive into the data right away. You know, really in the beginning, if you go to the next slide, we wanted to understand what our patients were going through. We knew it was going to be hard for them. And in early April, if you can remember that far back, because for me, it feels like I've lived several years since then, not just months, but we launched a very quick survey that said, we just need to get our hands around this. How can we best pivot where we are at Xero to help these patients as quickly as possible? So we asked three simple questions. What are your greatest needs related to prostate cancer right now? What's the most important on your mind? We really wanted to get inside their heads. And then what are 5 words that best describe how you're feeling? So let's start with the last one, because we did a word cloud that you're seeing right here on your screen on the answers we got. And I guess it's not all that surprising to see that the concern outweighed the positive. Some of what we saw clearly is that they're feeling anxious and worried and scared and sad. Again, not a surprise, but really wanted to figure out, okay, well, how can we alleviate some of that for them? So clearly patients were on high alert. We were concerned, they were concerned. So that was validated in this. And if you go to the next slide, we'll talk about their greatest needs. First and foremost, patients wanted to be safe. I mean, they know that they are at higher risk. They know they're more vulnerable. So staying safe was very important to them. We have to also put this in context. This is before all of the skyrocketing unemployment that's been seen in the United States, before the big loss of healthcare. Yet, interestingly enough, you're already seeing people talking about finances. I'm not going to be able to pay my bills, concerned about maybe that I'm going to lose my job. They're already kind of predicting some of these potential risks for them. So that was alarming to us because, but we also were right there with them knowing that this could be an issue. So when we tallied it up, more than 50% were concerned about their finances. So we knew that finances was going to be big. And we also knew just the access to support. I mean, they're anxious, they're isolated. They really need to be able to have access to emotional support. So those were some of our takeaways on their greatest needs. And on the next slide, you'll see really being able to read their minds. I mean, this was a really interesting question to say, okay, what's top of mind? What are the questions that are really keeping you up at night? And so we tried to kind of organize these a little bit into 5 categories. But I think generally what we saw is just general anxiety about the pandemic. I mean, clearly this was something that nobody really saw coming. They really were just trying to get their hands around what's next. And then you go directly to, okay, how is this going to affect me in my prostate cancer treatment? What are going to be the impacts specifically in that? Here again, you see the financial worries, the whole economic uncertainty. How is this going to affect my job and likely how I can access healthcare? You also see the government response kind of struggling. Obviously we have a lot of things going on in the United States versus federal response. So patients are picking up on that. And then also about their side effects, because they're wondering exactly how they're going to be able to deal with their side effects. Is that care going to be interrupted? So again, a good window. These are their exact questions summarized. So I think that kind of gives you a sense of how people are feeling. So clearly, after knowing this, we wanted to just launch into action, swing into action, and figure out how we could alleviate some of these things. So what we did just briefly was we immediately put together a whole mini site dedicated to COVID, specifically for prostate cancer patients, because we wanted them to have a destination where they could have a trusted resource and also understand what was going on in the pandemic related to them, because I think we all felt that there's barrages of information coming out about this pandemic, but really trying to filter that and curate some of that information for them. So I think that was a significant piece that we could do fairly quickly and get that out to patients. We also, secondly, recognized we got to be communicating with them more regularly. They need to hear from us. One of the most heartbreaking responses to the initial survey we did was, "You're the first person that asked how I was doing." You know, so they're feeling lonely. They're feeling isolated. So we ramped up our communications. We started talking to our patient community weekly, putting together resources, letting them know about our free support programs and how they could help them through this pandemic, really making sure that they were getting a nice drip campaign of where they could find resources, that they weren't alone in this pandemic. And one of the things that we added to that was a whole webinar video series, giving them direct access to experts, because we knew how important that was. They wanted to be able to ask real-time questions to the experts themselves. So we had medical professionals talking about telemedicine, social distancing, you know, what are some of the precautions they need to be taking? And those have been extremely well received, and we've continued to update the COVID website with different videos and different resources, and that still is a centerpiece of where we're seeing our patients engage and getting the information they need. So that really was taking us now through the summer. If you go to the next slide, we realized, okay, 4 months later, in many of our minds, 4 years later, because it just felt like we've all lived so much time since this, we really wanted to ask our community again. Things had changed, states had opened up, some had closed back down. There's been a tremendous amount of change, and we thought the 3 questions we asked, while were helpful and insightful, weren't enough. We need to know more about what is the interruption of care they're experiencing. How are they feeling about telemedicine? You know, we wanted to really dig in with telemedicine and then kind of get some feelings about their state reopening. So we did a follow-up survey that was more than 3 questions, but I think in total, I think it was closer to 8. So if you go to the next slide, you will see that we again repeated our word cloud. We treated it a little bit different this time. We used red for the negative words and blue for the positive words, so you could really see some of the difference. And not surprisingly, anxious was very consistent from the first survey. That is clearly, people are feeling very anxious still 4 months later. What we did see emerge more is depressed and frustrated were more reported in this survey than the initial survey. I don't want to overlook hopeful. We all need a silver lining. There is hopeful there, so people are hopeful. But if you look at this, unfortunately, it's mostly red, which again, I don't think is surprising, but helps us kind of determine, again, what is needed. There's continued needs. Patients are continuing to escalate their stress and frustration. So how can Xero be there for them? How can we kind of continue to alleviate some of this? So again, I think these visual things are just sometimes helpful to be able to see in a snapshot. Let's see here. So if you go to the next slide, you'll see a really important question that we added, which was, you know, was your care interrupted? And 24% reported yes. And the breakdown, as you can see here, number 1 was access to their doctor, to their healthcare team. The second one was diagnostics, surgery, and then as you go down the line, you'll see, you know, the treatments addressing the side effects, radiation, and then if they were on a clinical trial. So that, I think, was really helpful information for us. Sort of as a side note about diagnostics that I wanted to share. So I work closely at Xero with our medical advisory board, which is made up of urologists and oncologists, nurses, and social workers. And in the United States, in September every year, we celebrate Prostate Cancer Awareness Month. And we sort of at Xero make that our time to really hit home the importance of early detection and how important it is to go get screened, a real call to action to get screened. And this year I just felt like I need to talk to our medical advisory board. I want to understand what they're thinking in this through the COVID lens. And they, as much as they very much value early detection, were very cautious and said, we do not want to be an organization telling people to race to the doctor right now during this pandemic. We need to be much more specific to say, talk to your doctor, determine the best time to come, maybe not make the appointment this month in September, but make a commitment to yourself that you will make that appointment to get tested. So very, very different message than what we've had in years past. I think it's a smart message, but it really did strike me that that's where we are with early detection. So again, not surprised to see it second on the list here of areas of disruption. If we want to go to the next slide, this is what I think is one of the silver linings in this is you just saw on the last slide, interruption to being able to access your medical care was #1. Here we're seeing the majority of patients have taken advantage of telemedicine. Wonderful news. This probably is something that I think we all hope will stay with us in the United States and become more of an option for patients because it has been a limited option. And the good news is they rated it highly. So it wasn't that they tried telemedicine and had a terrible experience. The majority of them had a good experience. So I think that this is the silver lining and hopefully what we're going to see more of and to help patients access that critical medical care team and not feel alone so they can be getting the guidance they need. So want to celebrate the successes here, give us something to hold on to. If you go to the next slide, this is just some of the other observations that I thought were interesting to share. I did want to also go back and make a comparison to some of the original questions because we asked those same 3 questions again. And I don't think you'll be surprised to learn that safety was still #1 on patients' mind. In fact, it doubled as the biggest concern. So I think it was interesting to kind of compare by asking those same questions from April to July, where patients had evolved in their thinking. So clearly it was still about their safety. But I think these are some of the interesting things that came out of states reopening and how they're feeling about that. Clearly the unemployment in this country and the loss of healthcare has been drastic and devastating to many, many patients. So we are seeing certainly an uptick in patients reaching out to us needing support in that area. So #3 and #2 are really related in that sense. And then the consistent need of mental, emotional support during this. Many are not near a family. They can't go to their support groups anymore. Thankfully, people are doing some really creative things with the technology we're on today, Zoom and other things to connect patients, but that's been devastating for them to have that lack of access to their support group, whether it's family or other. So that came through loud and clear for sure. One of the things we asked you that's not on the slides, but I thought was interesting, is that we said, as a result of COVID, have you done the following? And we prompted them with a couple of different options. And one of those was delayed medical procedures, which was the #1 answer. But it also talked about missing bill, not being able to pay bills or missing bill deadlines. That was very common as well as a response, and then that they had actually sought both financial and mental health support, so that they took an action to actually try to seek out some of that support. So I thought that was an interesting insight as well. On the next page, I wanted to talk a little bit more about a case study that I just thought was certainly relevant to this group. Again, we have a fabulous case management program called Xero 360. It's a free service that patients can call in and get help with an issue that they're dealing with. 60% of the people that call that support case management are needing financial assistance. In this case, here was a patient who really was looking for assistance, knowing that his treatment wasn't available to him at this point. It had gotten postponed, so it made him think about what other options should I be looking at? You know, can I get a second opinion? And I think that, in all honesty, this represents many patients out there that have now questioned, you know, what should they do in this situation and what are their next steps? So I thought I would bring that to light because it was something that we uncovered as an actual patient who called our case management line during COVID. I'll just wrap up. I wanted to at least give everyone a little bit of a quick update or a quick overview on our patient programs because it has provided us a way to really help patients during this time. So if you advance the slide to our patient support programs, I just mentioned we have our patient navigation program that's been up and running now for 4 years. We have seen an absolute spike in the usage of this program during COVID, particularly around the loss of job and healthcare, and trying to figure out insurance and how to cover treatments during a time where financial issues are paramount in our patients' minds. Clearly, the testing program on here has not been utilized as much during COVID, so it's not as relevant. But if you go to the next page, you will see that we have a suite of peer-to-peer programs. We started several years ago with a mentor program pairing patients with other patients, not based on geography, but really based on what is the specific issue they need to know about. Is it about side effects? Is it about emotional support? Is it, you know, just trying to understand somebody who can be in their shoes because they're 50 and they want to talk to another 50-year-old that was diagnosed? Had a lot of success with this program, and just this year launched it for caregivers so that we could provide that one-on-one peer support for caregivers as well. And both of these programs have seen a spike during COVID as well. So we're just so glad that these programs were ready and in place, and that we have mentors and caregiver connectors who are waiting for patients and can take these cases on and be paired and matched with people who desperately need more emotional support because of the isolation they're experiencing right now. Lastly, we also have a online support group. It's a closed Facebook group. We have more than 2,500 people nationwide that are participating in that, and that's been wonderful to see. There's been so much engagement on that support group, and really has ramped up talking about COVID, but just also all the issues related to it. Much of the questions that you see were questions that we often see repeated and put out there for responses on the support line, so that, or the support group on Facebook. And then lastly, 2 programs that you're not seeing here but are in the works because they are also really needed are a transportation program that we have launched to help people get free transportation to their appointments, because we realize that is a huge barrier, obviously a little tricky in COVID, so we sunsetted that until we could figure out what was safe, but that program exists. And then lastly, with all of the health disparities that we're seeing in COVID, we have urgently revisited the health disparities that we're seeing in Black men for prostate cancer, and are putting together a whole nationwide task force on that. So just wanted to give you a well-rounded view of our programs and how we've been able to help patients during this time. Happy to take questions. I know that was quick. Tried to get a lot in there. That was helpful.
That was fantastic, particularly sharing, because we haven't had the patient perspective so much there. And certainly from, I got a lot from that, how things may change now going forward. So in terms of post-pandemic, as you say, they've got that extra burden. What would you see as the biggest changes? Would it be in the sort of more electronic, we've all got used to, like your patient support groups that are more electronic, and anything specific in radiotherapy, any tend towards that? Or how do you see it going forward now?
Yeah, well, I think that there's much more of a comfort level in people using the telemedicine. That to me seemed to come through loud and clear. We're definitely hearing from patients that technology has been critical for them to stay in touch. Unfortunately, you know, the average age of folks is older, and sometimes that can be a barrier because they just are not familiar with it, and that it requires somebody, if they have support, to be able to set it up for them and get used to it. You know, I think that it's interesting how you started the meeting with almost post-pandemic, which I understand, but our country, I do feel like, is not quite there yet, unfortunately. Unfortunately, we need to be following the example of all of you on the phone and what your countries have done. It is, I would say it is very different here in that people feel that we are very much in the thick of it. And I also think that a lot of our patients do have children or grandchildren, and they're very concerned about schools.
No, that's interesting. Have we got any more questions from the people on the call? I thought it was very interesting too about the financial worries, because obviously here in the UK with the National Health Service, we have less worries about the money, but we have absolutely more patient disruption in the services. It may be free, but you may not be getting it. Yes.
Right. Yeah. No, it is unique to our country that is such a concern. It's a huge concern. And I think that if you look at unemployment, it really is on unprecedented levels right now. So,
and I think going forward, in terms of what we're thinking, how we can help the sort of more global community in radiotherapy going forward, we must be conscious of the effect on patients and their finances and the differences. Now, that was hugely helpful. Thank you so much.
Thank you all so much. Thank you. Have a wonderful
Thank you so
day.
much, Connie. That was wonderful.
Anytime.
Thank you.
Thank you all again.
Shandy, our second speaker today.
Yes, I think I see Geraldine is on the call. Great. Hi, Geraldine. Many thanks for joining us. Geraldine joins us as the section head of the Cancer Control Review and Planning section of the International Atomic Energy Agency, or IAEA. She is going to talk to us about their recent collaboration with the WHO on some reviews of cancer, including a focus on radiotherapy and nuclear medicine in low and middle income countries. So many thanks, Geraldine, for joining us. I know you got thrown in here by one of your colleagues, so I really appreciate you joining the coalition to share what you all have been working on over at IAEA, and I know we're really interested to hear some more details about that. So without further ado, I'll turn the time over to you, and Sam has your slides, so just go ahead and tell us when you're ready for the next one.
Great. Thank you very much, Shandy, for the introduction. And I do want to acknowledge that my colleagues, Lisa Stevens, the director of PACT, is on the call, as well as Anya Nietzsche, who heads the resource mobilization team. And I believe some of my colleagues from the technical department also might be on the call, my colleague Eduardo Tubizarreta. So thank you. Sam, you can go ahead and go to the next slide. I mainly want to give you an overview of how we are conducting the impact reviews assessments in the current situation of the pandemic, where our ability to be present at the member states is very much hampered. Just for context, the IAEA has been delivering technical cooperation support to the member states for over 60 years in nuclear medicine and radiation medicine, covering both the areas of diagnostic and treatment. We have invested more than 170 million euros since 2011 in support to cancer-related projects. And right now we have about 115 active projects, both in the areas of diagnostic and treatment in more than 100 member states. We can go to the next slide, and I can tell you a little bit about the different divisions and departments involved in this effort. It is a one-house approach at the International Atomic Energy Agency. The TC programs, the Technical Cooperation Program projects, are managed by the Department of Technical Cooperation, where my division is also based, the division of the Program of Action for Cancer Therapy. And we have 4 regional divisions covering the different geographical areas which manage the project. And these projects are count on the technical support from the Department of Nuclear Sciences and Applications for the human health part, as well as from the Department of Nuclear Safety and Security, because we want to ensure, and we have the responsibility to ensure, that we support member states in making investments for diagnostic and treatment in a safe and secure manner. If we can move to the next slide, I will give you a brief outline of PACT's areas of work. The Program of Action for Cancer Therapy has existed since 2004, and the areas in gray are the 3 very broad areas of our work. First are the impact reviews. These are the integrated missions of PACT, where we assess the situation in member states regarding cancer control, and these are done together with WHO, with IARC, and internally with the stakeholders that I mentioned before. The second area is the resource mobilization block of our work, which my colleague Anya, who's on the call, leads, and we support member states to mobilize resources for the needs in their cancer control efforts that have been identified through the impact reviews conducted. And the third area of work is supporting the member states with development of strategic documents, so that these assessments don't stop there at the recommendations level, but that we really support the member states in moving ahead with more concrete action plans, or bankable or funding documents, or plans for cancer control or for radiotherapy, etc. We can move to the next slide. So just to highlight, through those 3 areas of PACT's work, we're very much working closely with our stakeholders in-house and with WHO and IARC. And I want to tell you a little bit about the efforts deployed for the past 1.5 years to revise the methodology that we use to conduct these impact reviews. As I said, these reviews are a joint assessment. They're done together with WHO and the International Agency for Research on Cancer. Well, we typically go to the country at the request of the member state to assess capacities and needs, and the readiness of the health system to tackle the cancer burden. And we've made changes to the methodology. This has been completed earlier this month. And some of the key elements of this revised methodology are the following. First, we're working more on a stronger preparatory and desk review phase. We have also, together with the member states, sought to increase the level of ownership. Typically, the member states would nominate one focal point to be our interlocutor in this process. And what we are seeing now is that we're working with an entire team of experts at the country level, which mirrors the entire cancer control continuum. So the member state would nominate a team beyond just one focal point. And this is the team that would be paired up, so to say, with the international experts that the IAEA, IARC, and WHO appoint for the impact review. We've also worked on a continuous process with WHO to streamline the data collection effort and the analytical tools that are used for the reviews, so that we can combine tools and in cases, for instance, if WHO is planning a specific assessment of one area of cancer control, and we are planning together an impact review, that we find ways to bring both processes together and seek more efficiencies on the part of the member state. We are working on ensuring a more systematic follow-up, as I mentioned before, to make sure that the reports that are issued to the member state don't stop there with a list of recommendations, but that we continuously try to bring those recommendations and those assessments alive in different programming processes. The other critical element of improvement has been the shorter timeline for submission of the reports to the member states. As you would appreciate, these are reports that have the seal of 3 international agencies. So it does follow a very strict clearance process. We are working towards a timeline for submission of 12 weeks after the conclusion of the in-country mission. And the last point, which is really cross-cutting through the entire work that we're doing, is our stronger collaboration with IARC and with WHO at regional and at country level. Sam, we can move to the next slide, please. Thank you very much. I wanted to also give you an idea of the concrete countries where we are working on right now. So on green on this map, you can see the 101 impact reviews where they've been conducted in 93 countries, 101 in 93 countries, because some have had repeated reviews. And we are working right now on 6 countries, 4 in Sub-Saharan Africa that you have there on the screen: Central African Republic, Democratic Republic of Congo, Mali and Senegal, plus Iraq and Nepal. These are the impact reviews that we are currently engaged in, and as you can imagine, we have had to adapt very much the modality through which or in which we work. So if on the next slide we have a diagram of the timeline. The engagement with the member states is about 15 months. So if we look at, there are 3 blocks. On the left you have the preparation, in the middle you have the impact review, and on the right side we have the follow-up. So for the 6 countries that I mentioned before, we are closing the first block, the preparation block. We received the request from the member state. We've identified with them the scope and needs. They have established their national team, and we have nominated our technical officers to accompany that national team and to start the test review and analysis. And we are ready to move to the next phase, which is the self-assessment. And an analysis for all of the 6 countries is already conducted. Now, the COVID-19 situation puts a halt to the typical next step, which would be to jump from the first yellow circle to the next one, which would be to start hiring actual experts and moving to the in-country mission. We can't do that, of course, because we're not able to travel to the countries. So what we are doing is that we have discussed with the different member states the possibility to turn some of these reviews to have a hybrid or modality. So we are doing a lot of the meetings that would typically happen at Ministry of Health. We're doing them virtually, and we will at some point have that in-country mission. But that would be a different nature. It would not be to conduct the full set of interviews or of meetings that would typically happen in country, but rather for 2 or 3 things. One, there are things that the international experts team really want to verify. You do want to see with your own eyes, even if we can rely on data, photos, and videos that would be submitted to us by the government before. But there are things that you really only see with the naked eye being there. The other thing is also which is critical for this type of missions, is the access and the direct contact with the senior level of the Ministry of Health, and that's an opportunity that we don't want to lose. From that point of view, we would hope that at some point when the pandemic stabilizes, we're able to travel to the countries. It would be then a reduced team. Typically, the expert missions involve about 10 experts covering the entire cancer continuum from prevention to palliative care. So we would not see the need to travel the entire team to the different countries, but a reduced group to go and discuss specific things and really validate the report findings at the national level. And if we look at the follow-up phase, we're also having to do a lot of that virtually right now. So for some countries, at their request, we would deploy follow-up missions to support whether it is sensitization of stakeholders at the Ministry of Health or other entities in the government, or to do a stock taking of how recommendations have been implemented, or to move forward with NCC, National Cancer Control Planning. Again, there we're not able to do that for countries where we've conducted impact reviews in the past years. So we are doing these follow-up virtual meetings together with WHO, our program managers from the regional divisions, and our technical officers virtually. We have started planning these calls over the past few weeks. Of course, the ability to conduct them will depend on to what extent the Ministry of Health has a bandwidth in the figurative sense to deal with matters other than COVID-19. And I think that's the last slide that I wanted to share with you to illustrate how we are working in this COVID-19 phase, really trying to maintain the engagement with the ministries of health, but giving them the flexibility and the ability to focus on what's really the priority right now, which is addressing the immediate urgent consequences of the pandemic. Just to reiterate, as I've mentioned, WHO and IARC, which are the key partners of the IAEA and the Program of Action for Cancer Therapy, but we also work very closely with the UICC members as part of the network of the Union for International Cancer Control. This is the grouping of civil society organizations working on cancer, and also with our partners in the International Cancer Control Partnership. Thank you very much. I'll be happy to take any questions.
Great, so great, fantastic. So some questions for Geraldine here. I have one in terms of, it was a great presentation seeing what you're doing. What do you see as your biggest problem now and the biggest problem going forward over the next year? And we hopefully we're better with COVID. What are those fundamental problems that you see?
Well, I think I see problems, but I see opportunities, yeah? Mm-hmm. Problems, I think the main thing is our counterparts are the ministries of health. And if they are preoccupied and consumed, we're talking about low and middle income countries here. We're not talking about the US, the UK. We're talking about low and middle income countries, especially the countries with the lower income have limited capacities, and often the people who are working on cancer issues have been repurposed to work really on COVID preparedness and response. Mm. So in the absence of our ability of our interlocutors to discuss with us the next steps, our hands can be tied. They're not tied, but they can be tied, yeah? So we are respecting their need to focus on COVID-19 while trying to maintain their attention to the NCD and to the cancer agenda, which is very important because we want to pave the way to ensure that national budgets don't become fully focused on COVID-19, and that the NCDs and the cancer agenda the cancer issues stay high on the national agenda. And this is also a key message that WHO in their series of dialogues with ministries of health over the past month has been conveying also as part of the efforts of the NCD Alliance. In terms of challenges, and Anya, maybe you want to add a little bit of that, but it will also be how the donor support to the cancer efforts will pan out, and how the donor budgets are being reshuffled, rethought, restructured to respond to the pandemic. But I also see a big opportunity for us, which is internally, if we look at the IAEA, our program cycle for the period to 2022-2023 is now being actually planned. So the projects for 22-23 are being discussed right now with the ministries of health, and we are seeing, despite the pandemic, we're seeing interest, we're seeing a lot of proposals coming through. So there is this, I see very much as an opportunity to remain engaged with the ministries of health despite the pandemic. And the last point that I want to mention is that I very much see that the pandemic and the different ways of working, teleworking, virtual efforts and so on has also demonstrated to our Ministry of Health partners, who were many typically used to to put it in simple terms, a virtual meeting was not a real meeting. And this has changed. And we have seen a lot of high-level engagements taking place virtually. Of course, they have issues. Not all countries have the connectivity that's needed. Not all countries are able to have this type of meetings with the safe and standard connection that we're having. But at least it's also the fact that the World Health Assembly was held online. I think for our Ministry of Health counterparts, it also passed the message, okay, we just need to rethink the approach, and what's the alternative? And I keep repeating, the alternative is that we say, okay, we close shop for the next year, and then when we're able to travel, we talk again, and that's not what we want to do, right?
No, that's good. Anya, did you have any comments? Bring you in here.
As well, which are the countries?
Can I have?
Yes. This is Anya. Sorry, I just had to find the unmute button.
And then we have a question from Joel as well.
Yes, thanks a lot. I think I already mentioned last week also, or 2 weeks ago at our recent engagement, that there are indeed, as Geraldine had mentioned, there are implications, of course, for the resources that are available for our programs, and we're quite worried because we see that attention is being more directed towards the COVID pandemic and other issues. Although, of course, the needs of cancer patients remain, and they keep growing, and we are seeing particular negative impact on cancer patients, as you've also already highlighted also in your earlier sessions. But at the same time, I think as a community, we need to look at how we can use this as an opportunity to make sure that we are also reflecting, needs of cancer patients connected with current funding decisions that are being made around strengthening health systems, etc., because you can do it in a smart way to benefit directly also from COVID funding, which is coming from different streams, to make sure that we are strengthening health systems, in particular also access to cancer care, which is a poster child of universal health coverage in our view.
I know that's really helpful. And just from the question from Joel about which countries are planned for future reviews.
Yes, so it's the 6 countries that I put on that we had on the slide, and I think Shandi, if needed, you can feel free to share the PDF of the slide set. So 4 in Sub-Saharan Africa, Central African Republic, Democratic Republic of Congo, Mali, and Senegal, plus Iraq and Nepal.
Right. Okay. No, that's really helpful. And a final question from Therese then about what are the most common conclusions and hurdles from the impact reviews?
So the recommendations are structured along the cancer control continuum areas. So WHO would send the experts that cover the prevention part, and I can't say general because it really depends on country and on region. But we look at recommendations on prevention, on early detection, diagnostic, treatment. We also IARC looks at the part on surveillance and data registration, and how cancer registries and how that is structured in country, and whether it's conducive to really informing the decisions and the plans of the government. Then the IAEA would make the recommendations regarding diagnostic and treatment. Just to illustrate, this doesn't mean that in every impact review we would recommend establishment of a nuclear medicine or radiotherapy capacity. We look at the cancer burden, and sometimes it makes sense, sometimes it doesn't make sense, and then what the country rather needs to work on is on the referral pathway to make sure to make best use of the capacities in the region. Yeah. And then it also looks at the palliative care element. One important thing that's not left out is, and this is if we have to think of one general recommendation, is the extent to which the cancer governance is structured at the country level. And in the absence of a steering committee or really a strong office or body or a small team to bring the different stakeholders together. In those cases, we see a lot of challenges because in the absence of someone with that convening power to bring together those planning, those implementing, those allocating budgets, those working on or putting available the education opportunities to address the workforce needs, etc. So that cancer governance point is very important.
No, that's really good. Well, it's fantastic you're able to support these countries like that, and it's interesting you were saying about really in terms of having to keep the cancer on that top agenda in lower and middle income countries, and I've had to spend the morning on British television trying to make sure England kept cancer at the top of the agenda. So I think it's a very shared thing, isn't it, really? Because we could lose that, and yet the deaths from cancer can be as high as COVID. It's really interesting. Thank you so much. Which goes nicely into our last few minutes then, with very much needed here to go through from Birgit telling us, okay, what should we do now? What's our strategy of this global initiative now, this global collaboration as we go forward? So Birgit, have the floor for a few minutes.
Yeah, thank you, Pat, and also thanks to both Colony and Geraldine. Very interesting, and I think it's important as we work together as this community to make sure we're leveraging each other's strengths and working collaboratively. So I wanted to revisit, I shared this, we've made some tweaks based on the discussion we had at the last meeting, and then also wanted to talk a little bit about the next steps, which I hope many of you will actually be contributing towards. So the vision of the Global Coalition for Radiotherapy is that we are a global radiotherapy community using our unified multidisciplinary voice to accelerate advocacy and implementation of best practices in radiotherapy for all patients who need it. I think that's a very nice aspirational vision, but it's achievable. Our mission, what's our purpose for being here on a monthly basis? We achieve widespread understanding and proactive implementation of best practices in radiotherapy. We do this through collective partnership, knowledge sharing, and problem solving to ensure all patients who would benefit from radiotherapy have equitable access. And I think that actually ties in very nicely with what we heard today. Last time we talked a little bit also about, is our focus on, low and middle income countries? Is it developed world? And I mean, this is a global community, and I think there are opportunities as we dive into, on the next slide, what our strategic objectives are, that we focus specific programs and projects in the countries, again, ensuring that all patients who could benefit from radiotherapy have access. So the objectives over the next, between 2020, so now, and 2022, are to proactively engage global stakeholders in a transparent and inclusive forum to ensure that radiotherapy is prioritized and implemented as a critical, economically justified, patient-centric treatment modality for successful cancer care. I think this is absolutely important, and it's as we heard from our speakers today, and certainly over the last several months, that's what we need to do. We advocate for accelerated and widespread implementation of state-of-the-art radiotherapy technology as part of every country's comprehensive cancer plan, leveraging the global digital revolution to advance progress. So here again, making sure that we tap into the cancer plans that either are in place or are being put in place, also under the WHO resolution, leveraging as well telemedicine that we heard about today. So really taking the best practices here to further our mission and vision. And that we work together collaboratively, capitalizing on our strengths and expertise efficiently and effectively to accelerate the global equitable access to radiotherapy. So these are big strategic objectives over the next several years, but they're certainly achievable. And if you go to the last slide, thanks, Sam. we're now putting the meat around those strategic objectives. So what specific actions do we need to put in place? What are the metrics? How are we going to measure our success and the key performance indicators? What kinds of resources do we need? Who do we potentially partner with, et cetera? So that's now the meat that's going to be put behind the plan. And one of the things that we want to do as part of that is to have interviews with the Global Coalition speakers and the participants, as well as the original invitees. We want to validate what I just shared with you, and to ensure that the Global Coalition has a place and that our mission and vision are serving the right purpose. So what I'd like, certainly here we have a number of people who have participated in the calls. And I'm including people from industry and from, all the participants. This is not limited in any way. So if you are not interested in being contacted by myself, can you please reference that in the chat, either to everybody or just to me? Otherwise, I'd like to have the option to reach out to certainly all of you, and of course others who aren't able to be here today, to really just take some time for maybe a half-an-hour telephone interview over the next month. So that's the plan, and in parallel we'll be defining the additional content so that we have a complete plan ready to go by the end of August, hopefully, with the input from everybody. Again, just making sure that the Global Coalition has serves a purpose that is appreciated and validated and valued by all of those participating. So that's how we can drive advocacy, of course, and implement best practices. So I'll pause there and ask for questions. And again, if you have any reluctance at all to participating in a phone call, please send a chat.
That's great, Birgit. Any questions? Oh, well, that seems all pretty clear then. Great. And Birgit, thank you for leading on this next bit with us, which is going to be really important. So, okay, I'm conscious everybody, this has been great. This has been 3.5 months and everybody's worked really hard. And I think we've got us to a great place. So perhaps over our sort of 4 or 5 week summer break, obviously there's Twitter available and there's the website and everything that people can be in touch. Next in September, our first meeting, Mary Gaspadarovich is going to talk to us, obviously previous head of UICC, and hopefully we'll, over the next few weeks, we'll be working on our strategy and really feel very much ownership of all the people coming. Is how can we make the best of radiotherapy going forward now and get that access for anybody. Any final words from Birgit or Shandy?
No, very good speakers today. Thank you.
Thank you to the speakers very much.
Fantastic. And thank you for everybody for sharing all your experience. It has been fascinating. Great. Take care, everybody, and we'll talk again.